Smile greetings. You are watching my channel, Learn Sujok for free. And I am Teja Lupal. Friends, this is the 5th course with 10 videos in which you progress to energy healing. In this course, you will actually enter the magical world of energy healing using meridians. In order to gain from this course, you must watch my videos in the order that they are given chronologically and also watch each video till the end. If you like my videos, then subscribe to my channel and press the bell icon next to it.
Okay, now in this video, let us learn about the treatment on the basis of the energies that you have mastered now. I hope you have mastered that. Now that you are, familiar with the 6 energies and their specific properties and characteristics, let us understand how we can do treatments on the basis of these 6 energies. Let's start with an example of any kind of movement in the body, as eyes fluttering or a tremor. These are all indicating too much wind energy in the body, because wind energy, remember, depicts movement. So in order to stop these movements, what will we do? We will sedate the wind energy so that the excessive movements stop. If the movements are acute and expressive, that is, they have just begun and are showing currently, then we will sedate the yang wind. That is Ah wind, AH wind, right? Meridian, which is the Ah wind meridian, which is the gallbladder meridian. According to Access law, Ah wind is the gallbladder meridian. And how will we do that? We will do it with color or magnet. Like I had told you in my previous video, that tonification of any meridian is done with its given color according to the Access law, and sedation of any meridian is done with the opposite color according to the Access law. So wind energy color is green, which we use when we have to tonify the wind energy. But here we want to sedate wind energy. So we will do it with yellow color, which is in access with the wind energy. The technique of applying the color or magnet for sedation, I have already explained in my previous video. If you have any doubt, just go back and watch that video again. Always start the treatment with a smile. That is one rule that you have to follow, and you just have to follow. It is mandatory. And do the treatment with a smiling consciousness. Only one thought should be there in your mind while applying the color or the magnet, that I am sedating wind energy so that the excess movement in the body stops or is reduced, so as to harmonize the system. The deeper your thought or the deeper your consciousness, the better and more effective your treatment will be. Never give many commands at a time. This can damage the immune system. One strong command or one treatment with deep thought, deep consciousness is enough with your target in mind. In acute diseases, do the meridian treatment every day for 1 to 2 hours till healed, but not more than 12 days at a time. Then pause for a few days and then repeat if necessary. In chronic diseases, when you treat the yin meridians, then you should do the treatment on alternate days or for 2 days in a week, and for just 12 times or 8 to 12 times. Then pause the treatment for a week, and if necessary, repeat again. Follow these simple rules and just, experience the amazing, miraculous results. I would like to make a table now and write down the meridian treatments for various diseases based on their energies. Let me go through them with you so that you get a general idea about how meridian treatment has to be done for various problems. I will go one disease, one energy at a time so that you understand thoroughly each energy. Now, this is wind energy, okay? The disease, number 1 is tremors anywhere in the body. So tremors anywhere in the body or eye fluttering, the next one, is also, these are movements, right? That is why wind energy has to be treated. And because these, if they are acute, if they have just expressed themselves, then you will do Ah wind sedation. Now, when the arrow is pointing down, that means it is sedation. And when the arrow is pointing up, that means it is tonification. And according to access law, if you should always have a picture of the access law in front of you, maybe stick it to a wall in front of you so that you remember whenever you are studying this. According to access law, the wind organ is gallbladder, right? And the wind, the chronic, for chronic problems, the wind organ is liver. So if you have a chronic tremor, then you will sedate the liver meridian. And if you have acute problem, then you will sedate the gallbladder meridian. Now, similarly, same is the case with eyes fluttering also. So wind sedation for acute problem and wind sedation for chronic problem. Wind being gallbladder and wind being liver. And in case of eyes fluttering, I have written that treat eye problems in a, in some system like correspondence system, like in the main correspondence system or the finger correspondence system. Along with this, that will give better results. And remember to put the end points also. Okay, the third is arrhythmia, which is heartbeat when the pulse is very fast. Again, that is the case of movement because the heart is beating very fast. So we will treat it according to wind energy. For an acute problem which has just occurred, wind sedation, and for chronic problems, wind sedation. Wind sedation on gallbladder meridian, wind sedation on liver meridian. Tachycardia is again slow pulse, which is the opposite of arrhythmia, fast pulse, but it is also a case of movement. In this, because the movement is slow, we need to tonify the wind energy because the energy is less. So we have to increase the energy in the wind meridian, right? So for acute, in the gallbladder meridian, we will tonify, and for chronic problem, we will tonify the liver meridian. In case of vertigo, vertigo is also a movement problem and a wind energy problem. So in case of vertigo, if a person has just suddenly developed the symptoms, then you could do wind sedation, sedate the gallbladder meridian. Or if the person has a case of vertigo has been going on for very long and it is a chronic case, then you will sedate the liver meridian, which is the wind meridian. And you should also, for vertigo, also treat the corresponding points of brain and ear, because ear is very important because it is some lack of balance or some disharmonization of balance in the ear which causes vertigo. Then next is frequent urge to urinate, which is also taken as wind energy working because you are wanting to urinate again and again. So in this also, you will sedate the gallbladder meridian for an acute problem. And this is usually an acute problem. This usually doesn't stay chronic, so I've not written chronic. But along with this, you can treat your urinary bladder in the main correspondence system, in the finger correspondence system, and the mini correspondence system, which I haven't taught right now, but maybe in the future. Then if a person gets up in the morning and is not feeling fresh, okay, when you get up and you are lethargic, as soon as you wake up and you don't feel fresh, you don't feel like getting up, that means your liver is not functioning properly. This is also a movement problem and a liver problem. So we will treat the wind energy only, wind, because wind is liver. We have to tonify the liver. So this is how, so the liver meridian has to be tonified in this case. Next is heat energy, right? Heat energy. Now, heat energy is like if you have, the case is like if you have a high fever, all right? If the fever is acute, like it has suddenly happened, then you will sedate heat, which is small intestine. Mostly with fevers, when you get fever, and it is like, just 1 or 2 day old or 3 days old fever, it gets treated by sedating the small intestine meridian, which is the heat meridian. Fever is caused by heat, right? And next case is if a person is anemic. Now, remember, the heat energy is for the circulatory system. It depicts the circulatory system. So any kind of blood disorder, any kind of disorder in the circulatory system, deficient blood, anemic, any kind of blood disorder, you have to treat the heat energy. And heat energy is the small intestine meridian or the heart meridian. If the problem is acute, which has suddenly expressed itself, you treat the heat, the tonify, because you are anemic. There is less blood in you. So therefore, anemia especially, you do tonification, and that is tonification of the heat meridian, which is the small intestine meridian. And for chronic problems, a person, if he is chronically anemic and has a serious issue of being anemic all the time, he should treat the heat meridian, which is the heart meridian. Then infection. Now, heat is something that causes infections, right? This is also logically understood. So all kinds of for all kinds of infections, you have to sedate heat. So for acute infections, sedate the small intestine meridian, which is the heat meridian, and for chronic infections, sedate the heat meridian, which is the heart meridian. Then menses. Now again, menses or periods in girls is blood disorder or blood related issue, right? So if there is lot of bleeding, then to cure that, you have to treat the heat energy. If it is acute problem just during the menses, just during one session of menses, then you have to do heat sedation, that is sedate the small intestine meridian during that time. That will stop the too much of bleeding. And if the problem is chronic and it happens in every cycle, then you should treat heat meridian, which is the heart meridian. And also along with that, because it is a chronic issue, treat the corresponding points of uterus and ovaries, and also put an endpoint seed, a fenugreek seed on the endpoint of the heart meridian. Remember that. So this is how you will treat for that. Then this is how we combine, this is how we combine the energy treatment with the metaphysical with the physical to get the best results. The metaphysical is when you are just sedating the heat meridian, and we are doing the physical treatment along with the metaphysical, mostly for chronic problems, because so that we address it from both sides. That is why for chronic issues, we do the metaphysical, sedate the heat meridian, which is heat meridian, which is the heart meridian, and also do the physical treatment by treating the corresponding points of the related organ, which is the uterus and the ovaries. And it works much better, and the healing is much faster. Even if there is menses which are like no periods or less periods, in that case, you will obviously tonify the small intestine meridian or no periods or less periods are a chronic problem. It is not an acute problem. So for this, you will always tonify the heart meridian. And again, along with that, because it is a chronic issue, treat the corresponding points of uterus and ovaries and apply the end point for the heart meridian endpoint. Any kind of hemorrhage. Now, hemorrhage is also blood related when too much of blood flows out. For that, you will obviously sedate. If it is an acute, for example, some accident occurred and a blood hemorrhage, some kind of hemorrhage is happening, then you have to sedate the heat meridian, which is the small intestine meridian. And usually hemorrhage are acute problems only, not chronic. So basically you will have to sedate the small intestine meridian. And also because it is a very serious issue, you should also, and although not chronic, but it is a very serious issue, so it would be advisable to treat the corresponding point of the organ where the hemorrhage is happening. So in case if it is a brain hemorrhage, just put a couple of seeds on the brain point. If there is some other hemorrhage in some other part of the body, just put a couple of seeds on the corresponding point of that organ. Okay, next is hotness energy. Now, hotness energy, first case is like hotness energy means a lot of expansion. Okay, it is more than heat. Heat is lesser in strength or in potency than hotness. If there is a lot of sweating and a person is thirsty again and again, that means there is too much hotness inside him. So for that, if it is acute, when it happens, like say you have very, very high fever and you're sweating a lot and you're feeling very, very thirsty because you're, losing water from fluids from your body due to dehydration or something like that, then you have to treat it as acute, and treat the hotness meridian, which is the spinal cord meridian, the triple warmer. So just sedate that meridian, and if and because spinal cord meridian has to be sedated if there is an expression of this, like a lot of thirst and sweating. But if this is a chronic problem for people, some people have that kind of a constitution where they sweat a lot all the time. For them, then you have to sedate the hotness meridian, which is the brain meridian. And then in that, you will also, maybe treat the skin area or whatever is related in the correspondence system to get a better result. In case of menopause, when women, remember the hotness age is that when a person has reached maturity, and menopause happens when, you've reached maturity, and after that, the descending starts, right? So in case of menopause, when a person gets, when a woman has a lot of hot flushes, she gets up with a lot of hot flushes. In that also, you can sedate hotness, hotness meridian as the triple warmer meridian, because this is a very expressive symptom. And because this is related to your reproductive system, you can also, in spite of it being an acute problem, you can still treat the corresponding points of the uterus and the ovaries. Then for high blood pressure. Now, high blood pressure is also an expansion because, the blood pressure, this is a blood disorder which is showing a lot of expansion, a lot of hotness energy. So when the blood pressure is extremely high, then just sedate our hotness. That means sedate the spinal cord meridian. And but if the high blood pressure is like just normally high, like a little bit high, not extreme high, then you can do the chronic one, which is hotness, which is sedate the brain meridian. Okay, so extreme high is something which doesn't happen all the time. It is more expressive and it suddenly happens only. It is an acute problem. That is why we are treating the hotness meridian, which is the triple warmer meridian. Okay, but normal high BP is a chronic issue. When a person has it, usually, keeps having it and for a long duration of time. So in that, we treat the brain meridian and sedate the brain meridian. For obesity, fat but fit, like I've written Saroj Khan, I don't know if guys know, but a person can be fat, but he can also be extremely fit. All right, dance and do a lot of things, have a lot of energy in them, but they're still fat. So that is hotness energy. So you can sedate the hotness energy in that if you need to curb, kind of curb obesity by doing the hotness sedation, or if it is a chronic thing, then hotness sedation. If there is too much bleeding, like, a little bit of bleeding was treated by heat energy, but when there is too much bleeding, then, which is not being able to manage the bleeding, like it is just too much, then it is hotness energy because there's too much expansion. If the bleeding is manageable, then you treat it according to heat energy. But if the bleeding is too much and you're not able to manage it, then you treat it according to hotness energy. So if it is, usually it is acute only because it might happen suddenly due to some kind of, accident or something. So then our hotness has to be sedated, which is the triple warmer sedation, right? And also wherever the bleeding is happening from, that treat the corresponding points of that organ. Put at least a couple of seeds or something, or massage those points. If you don't have seeds, just massage those points nicely. Sometimes that also stops the bleeding. Then gas in the body is again expansion of heat in the body. That is why it is hotness energy. Okay, so if a person has a lot of gas on sometimes just by eating wrong food or something, you can do hotness sedation and sedate the triple warmer, right? The spine meridian. But if a person has a chronic problem that he gets gas every day and is susceptible to getting gas after every meal or something like that, which is a chronic problem, then he should do hotness sedation, which is brain meridian sedation. And if there is just too much gas, like, a person is just going on belching, or, basically letting out gas from everywhere, just too much, then you can also try sedating humidity, because humidity energy, which is the next energy we are going to do, is for collection. And sometimes there is so much gas in the body and it doesn't even get expelled. There's a lot of expansion, but it doesn't get expelled, which actually ends up giving you a headache, or maybe some kind of, chest pain or something, because of the collection. So if there is too much collection of gas, then you can try humidity sedation. Okay. So this is that. Now, next is humidity sedation. So in this, I've already explained that if there is too much gas, you do humidity sedation. Now, humidity is for collection, right? So water retention, pus, all these things are collection. So in this, if the water retention is acute, then humidity sedation, humidity means the stomach meridian sedation, right? And if it is chronic, if a person has chronic water retention and is, things like edema and all that stuff, then you can do humidity sedation, which is sedate the spleen and pancreas meridian. If a person has pus in some part of his body, that is also collection. So if it is just, sudden expression or sudden acute, then humidity sedation, stomach meridian has to be sedated. But if it is like some people have some problem in, say, in the intestine or something, and pus is being made and going on coming out, and it becomes a chronic problem till surgery is not done to treat it, the pus keeps coming, that becomes a problem, a chronic problem. So in that case, then humidity meridian, which is the spleen pancreas meridian, has to be sedated. And also I would add in this that you put a couple of seeds on the organ that is affected. Definitely. I've not written it here, but you definitely apply a couple of seeds on the corresponding point of the organ from where the pus is coming. If it is the intestine, apply a couple of corresponding points on the intestine. Find a painful point and apply. Then ovarian cysts. Now, cysts are also collection, a soft collection. Anything that is a soft collection comes under humidity. Anything that becomes very hard goes into dryness energy. So cysts, ovarian cysts, are usually soft collections. So in that also, and these are usually chronic because they happen all the time. And direction has to be given in this by treating. First, you sedate the spleen and pancreas meridian and apply corresponding seeds on corresponding points of ovaries. Phlegm. Now, phlegm is also a collection, expectoration, like you call it. So that also the same thing, humidity sedation, humidity sedation, and treat correspondence points, definitely. Then any kinds of lumps or abscess or boils, fodas are boils, which are not very hard, they seem like filled with water or something. They're soft. They're not very hard. They all can be treated by humidity sedation. If they are acute, which is stomach meridian sedation, and humidity sedation, which is the spleen and pancreas meridian sedation. Then any kind of fungal infection. Now, fungal infection is also humidity related because it is caused by humidity. So that also can be treated by humidity sedation. Then laziness. Now, humidity energy is usually because, it is the first of the descending energies. The one characteristic that it has is lethargy and laziness. That also can be treated with by sedating the humidity. If a person is feeling, suddenly one day he's feeling extremely lethargic and doesn't feel like getting up, and usually is energetic, but he feels lethargic at that particular time, just sedate the stomach meridian and you will see a change. Sometimes definitely you will see a miracle happening and the person will feel better. Then pimple and acne are also pimple and acne are due to heat energy, because in that case they are not they are not considered humidity energy. Sedate only heat energy only if there are too many. Otherwise there is no need to treat, as most of this is this is just a growing up thing. It is not something that is out of the ordinary. It's not a disease, right? Then dandruff is fungal, so obviously humidity, energy, sedation. Okay, obesity, when a person is obese and he is heavy and dull and lazy, like, most fat people are. In the hotness energy, we dealt with obesity like Saroj Khans or dancers who is fat but very active and dances and swims and everything, very active physically. But in humidity, obesity is when a person is fat and heavy and dull and lazy and doesn't do anything. So in that, you have to treat humidity sedation, but usually these people are chronic obese, so you have to treat humidity sedation, which is the spleen and pancreas, and along with this, treat liver and spleen corresponding points. Definitely liver and spleen. Liver, if you remember, is the axis of spleen as the wind organ, right? Soft tumors are again humidity energy, which is our humidity. So our humidity energy has to be sedated in this. Then severe itching. Severe itching is caused by, when a person is really itching himself, and to the extent that you start bleeding. In that case, you have to sedate dryness energy. But when the itching is such that you try and you just like to itch, if something is itching and you are liking it, it's not hurting or anything, then it is humidity, and humidity energy has to be sedated. And normal itching is like, just movement that you do or don't do, it doesn't really matter, but you can sedate wind if you want. All right, next comes dryness energy, which is the second descending energy. And in dryness energy, if you remember, there is contraction, there is, dryness, hardness, whatever. Not hardness goes into coldness energy, but there is a lot of dystrophy, of the organs. So first case is like if you have a lot of wrinkles, dry skin. If there's a lot of dry skin, a lot of people have dry skin issues. So you can address this issue by, sedating dryness energy. And dryness energy sedation can be done by sedating the large intestine meridian if it is a acute problem. And if it is a chronic problem, then you can sedate the dryness meridian, which is the lungs meridian. And another thing is, next case is muscular dystrophy. Like muscular dystrophy is something which is chronic because, the muscles are degenerating and they are losing their strength. So this can be treated by sedating the dryness meridian, which is the lungs meridian. And definitely treat the corresponding point of liver also in this case. This is just a tip I'm giving you. The reason will be explained later on. Then one very big thing that happens in this phase of life is the degeneration of the spine. So if there is too much degeneration of the spine, which is causing other issues, then you can try and sedate the dryness meridian. If it is acute, for example, because of degeneration of spine, if you have back pain or something, or some nerve is getting compressed, then you can do it as an acute treatment and sedate the large intestine meridian. But if it is a chronic problem and the degeneration of spine is causing other issues, posture issues and all that things, or sciatica pain, then you can even try and sedate the dryness meridian, which is the lungs meridian. For arthritis, which is literally all over the body, and arthritis, the big cause of arthritis is degeneration in the joints and everything, which is usually due to dryness energy. So for this also, you have to sedate the dryness meridian, which is the lungs meridian. For ulcers, now ulcers are not humidity energy because they are not that soft, they are slightly harder, and they they are due to dryness energy. So this can also, if they are acute, if it has just been diagnosed, then you can try and sedate the large intestine meridian. But if they are chronic and you have ulcers for a long time in your body, then you can sedate the lungs meridian, and also the corresponding point of the organ where the ulcers are. If it is in the stomach, just put a couple of points on the stomach, corresponding points, and definitely remember to put the end points for all the meridians. This is mandatory, remember. And I've already told you, if there is a lot of severe itching which causes bleeding, then that is a dryness energy and it has to be sedated. Fissures. Now, fissures are anal fissures, they are hard, but they are not like piles, but they can be treated as dryness energy. Because of dryness, you get these fissures. So in that case, also sedate dryness. If they are acute, then dryness, which is large intestine meridian. And if they are chronic, then dryness meridian, which is the lung meridian. And also you can even put a point on, seed on the corresponding point of the large intestine where it is affecting you, rectum or whatever anus. Function of any organ if it is affected, okay, because this dryness energy is at that level or at that age when the organs stop functioning properly. So if any organ is not functioning, then also you can sedate dryness energy and then apply correspondence treatment for the organ related, whichever organ is affected. So this is dryness energy. Then last of all comes the coldness energy. Coldness energy is the end stage. So all the things that have now, after degeneration, when they have reached that stage, which is like literally the end stage of a thing, like tumors, malignant tumors, cancers, all these are end stage diseases, and they are coldness energies. So you can treat coldness because these are all chronic diseases. So you can sedate coldness, and coldness sedation is sedate the kidney meridian, right? And for coma also, when a person loses consciousness and everything, then you can treat coldness, sedate coldness energy. But because it is now in this case, I want to tell you something. In some cases, it is better to do tonification rather than sedation. Because like in coma case, coma is when a patient is already unconscious and he has reached that stage where he has to be given some energy so that he can become conscious again. So instead of trying to sedate an energy, it is better to try and tonify an energy. So if you have to sedate coldness, so instead of that, if you do the opposite energy, which is, according to Axis law, hotness energy, that is the positive energy. If you try and tonify that, that will work better, so that he can come out of the coma. Once he is out of the coma, and if he still has the symptoms of coldness, then you can sedate coldness. But initially, for a couple of days till he comes out of the coma, try and do the tonification, which is the positive energy first. Then if a person feels very cold and shivering, usually with age, person starts lacking heat in his body and he feels cold. And at the, in the age bracket of coldness energy, which is like 60 to 72, 75 years of age. So that at that time, you can sedate coldness in that person. If it is limited only to the extremities or only to the hands or feet, you can also put correspondence, do correspondence treatment on those areas. Then stones. Now, stones are also very hard, and absolutely, like, stones are the end stage of any kind of growth in the body. So stones like kidney and gallbladder are total coldness energy. And for any of these, you have to sedate coldness in the body, and also treat the correspondence points for the kidney or the gallbladder wherever the stones have occurred. And lots of moksha. Moksha treatment works very well for dissolving stones. So if you do all these three things, your the stones will dissolve automatically and they will be expelled from the body. Then corn. Now, corn on feet. See, in dryness energy, the skin was getting dry, right? But in coldness energy, after drying a lot, it has hardened and become a corn. So it becomes coldness energy. And any kind of corn or boil or lump that has become very hard, because it has not been treated, that becomes coldness energy. And for that, you have to sedate the coldness energy. So depending on whether it is acute or, chronic. Now, for pains, I have written there are no pains in wind energy. If wind, heat, and hotness energies don't give any pain. All right. Pain only comes in the descending energies like humidity, dryness, and coldness. So in humidity, the pain is dull. It is not too much. So if the pain in any part of the body is dull, so then you should sedate humidity in that particular organ. Okay, but if the pain is very sharp or like cramps or something, sharp pain, then you have to sedate dryness, and you can tonify heat also to give it, power, that organ or that part. But any kind of pain which is so severe due to which you are bedridden or have to take support of others, that is the third stage of pain. In that, you have to sedate coldness, or like I said, do the positive treatment first, so tonify hotness first. Cramps without pain are a movement problem. Okay, so because you don't have pain but the cramp is happening, so that is wind energy. So then in that case you sedate wind, because wind energy does not give any pain. And pain after surgery, surgeries of all kinds are coldness energy, all right, because the organ has been cut. So any pain that is occurring after surgery, you have to sedate coldness. This was all about the treatments that you can do on the meridians. And I have tried to cover all the energies, and I hope you have got a good enough idea about, how these have to be done. Well, just doing this simple treatment can give amazing and sometimes even instantaneous results. This kind of energy healing via meridians is the absolute basic of energy healing. See you in the next video, in which I will be, touching another factor of energy healing, which is the chakras. I'll see you in the next video. Thank you.